Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Shabeena Hirani. She's a nurse practitioner, and today's Kevin MD article is From Nurse Practitioner to Quality Improvement Leader in Sleep Medicine. Shabeena, welcome to the show.
Thank you, Kevin.
All right, so tell us a little about your story and then the Kevin MD article that you shared with us today.
I'm Shabeena Hirani. I'm a doctor of nursing practice and board-certified nurse practitioner with over a decade of experience in internal medicine, pulmonology, and sleep medicine. And most of my work has been with diverse outpatient care settings in New York, where I have the privilege of taking care of patients who come from diverse backgrounds, and they face chronic illnesses, be it asthma, sleep apnea, diabetes. And my passion is not only providing direct patient care, but also driving quality improvement initiatives to make the healthcare delivery system more consistent, equitable, and patient-centered.
All right, now for those who didn't read your Kevin MD article, what's it about?
So it's basically, as you mentioned, the headline, From Nurse Practitioner to Quality Improvement Leader in Sleep Medicine. It really grew out of my own journey from focusing on individual patient encounters to looking at the system with patients around it. Early in my career, I noticed recurring patterns of missed appointments, underdiagnosed sleep apnea, uncontrolled asthma. And writing the article is just a way of reflecting on how I began designing solutions and structuring a tracking system for decision making.
And when you notice these patterns, like you mentioned, these underdiagnosis of sleep apnea, patients missing appointments, what will be some of the core reasons why those things are happening?
I wished I would have known this earlier into my practice. I think it's lack of awareness, where patients just do not know how dangerous and life-threatening these conditions are. And I think just spending that quality time with the patients that encounter and making them realize what it is and what can be done about it, I think makes the most out of the visit.
So you mentioned that you created or designed a structured tracking system for sleep apnea and asthma patients. So what is that? What does that look like?
So we basically designed we started at a very grassroots level of having Google Sheets, trying to track patients. Okay, this patient, has he come to pick up the device? Did he return the device? Did we test his study? Did we send him for titration? Simple things like that. But with the new EHR that we have now adopted, we will basically have these pop-ups in each patient chart as to things are not missed out, because you and me know how busy it can get with internal medicine, how demanding it is, and how easy it is to miss out on things. So these small things are something that we are looking into to redesign patient education and look up for system where sleep apnea and asthma is taken care of.
Now, can you tell me a case study or a story of this tracking system in action and how that improved care for that particular patient?
We have quite a few, but if we look at a study, so I have a patient, morbidly obese, comes to me, I want to get a bariatric sleep procedure.
Mm-hmm.
Okay, we need to do the pulmonary and the sleep apnea clearance. We send him for sleep studies. Okay, patient gets a sleep study, patient gets the machine. We talk about some lifestyle changes. We talk about sleep apnea and the treatment and the impact that it can have on the quality of his life. He's compliant with his sleep apnea machine and all of the lifestyle factors, of course. And what we see over a period of 4 months, as he was waiting for his other clearances, cardiology, psychological, psychiatric clearances, he lost so much weight that he canceled his bariatric sleep procedure. So this is something that's so impressive, that lifestyle changes are the key and core to making patients' lives easier.
So tell us a little bit about your practice where you implemented this tracking system. What's it like? Do you work for yourself, with a group, academic, owned by a hospital? What's your practice like?
So we are a multi-specialty clinic. I have Dr. Aslam Javani. He's the primary pulmonologist. I have been with him since 2014 when I was a registered nurse, and I worked with him. Under his mentorship and guidance, I was I was so impressed that patient care is so important, and being in the front of things and having a direct interaction is important. I went back to nurse practitioner school, simultaneously working. And then I thought I can do better and attain a terminal degree. And I went back to a doctorate in nursing program. So this is the journey so far. We are into a teamed partnership soon, wherein we see almost, I would say, 60 to 80 patients, depending on how the volume is per day. And we have cardiology, we have orthopedics that we have associated, and we take patients as a whole.
So, in terms of this system level improvements in care that you implement in your practice, other practices who may be listening to you, how can they themselves start to implement these system wide improvements? Because you're right, sometimes there's only so many things that we can do one on one in the exam room. We do need these tracking systems to do these more population based approaches. So, for those who are interested in starting out and doing something like you did, what kind of advice would you have for them?
So, the lesson that I would like to share is never underestimate the power of noticing patterns.
Hmm.
Often the small things are underdiagnosed. Small things like missed appointments, delayed testing, lack of education, these are signals to system wide opportunities for improvement. As clinicians, we have a responsibility not just to treat, but to step back, ask why these gaps exist, and design solutions around them. Also, mentorship matters, investigating in future clinicians and ensuring sustainable change. And that's what we do with students coming in, PA students, NP students. We have medical assistant students who come in, and so much that they love our practice that they want to get hired.
Hmm.
So I think this is something that speaks volumes about how things are done here at VXL.
And how do you notice these patterns? Is it through the electronic medical record? Does it track, of course, if patients miss a certain number of appointment and raises a flag? So give us a story of some of these patterns that you would
Yes.
notice and how you would
So,
act on them.
yeah, what we basically do is we have a consistent pattern in terms of documentation. We have chart alerts that come up with every patient's chart as to what we can do to make things better. We can be so busy seeing so many patients, and we have so much additional support staff that helps us tag things and helps highlight stuff, put things on patient cards that we do not miss out, things that we set reminders. Okay, offer pneumonia vaccine next visit.
Hmm.
Patient already received an RSV today. Things like that, that we are able to track and make a meaningful impact for the patient care.
Now, talk to us about the role of advanced practice providers like yourself in terms of leading system level improvements in care. How often are these initiatives led by nurse practitioners like yourself?
I think we can do better. There is a lot of scope of improvement for how nurse practitioners still being thought to be mid-level providers, wherein they are still considered to be somewhere in between registered nurses and MD physicians. I think when we are working in collaboration, we need to widen our horizons and give them a chance. And nurse practitioners need to step up. We need to make sure our voices are heard and our patients are advocated for.
Tell us about the time that you spend doing these system approaches versus one on one in the exam room seeing patients. Like, how is your time divided?
More than 50% of my time is in the room with the patient. And what I try to do with my visits is more than 75% time goes into counseling, education, and reinforcing positive behaviors like compliance with medications, compliance with their apnea machines, inhalers, stuff like that.
And in terms of the biggest challenges most clinicians face when it comes to this patient education piece, of course, is time. So I know how busy you are, like all clinicians. How do you fit in that time for that all important patient education piece?
I try to start with education. That way, that's not left out and not taken care of, because other things that come into perspective as to patient telling why they are here for, what's their problem. Yes, we definitely address that. We have that. Yes, we're going to talk about it. But with diabetes, What's your lifestyle changes?
Hmm.
What have you done so far? How are you with your diet, smoking cessation, abstinence from alcohol, stuff like that. I try to give that a priority because primary care and prevention is the key.
We're talking to Shabeena Hirani. She's a nurse practitioner. Today's Kevin MD article is From Nurse Practitioner to Quality Improvement Leader in Sleep Medicine. So, Shabeena, what do you have to looking forward? Talk to us about what initiatives you may be undertaking when it comes to that quality improvement piece and how that intersects with what you're doing.
I want to look at something wherein we are able to, just like you might know, we have a citywide immunization vaccine registry. I want a level of integration of electronic health record that if all of these are integrated to begin with in New York City, that I open my chart and I have when did the patient go to the emergency? When did the patient go to the urgent care? The patient was seen by the cardiologist. I should be able to have access to all of that integrated healthcare systems. That way, there's no duplication and replication of medications and continuity of care is maintained.
And how about those clinicians who are interested in integrating themselves more or participating more in quality improvement? Do they need to get advanced degrees, public health degrees? So tell us what kind of qualifications they may need, or is it just simply if they have the interest?
I think if they have the interest, and I think there's enough of support staff that is there out there for us to be implementing these things. If we are looking into, frankly speaking, making less money,
Hmm.
talking to the patient, and looking at what is the prevention part of it and trying to integrate all of this. I think a little bit more of IT help
Hmm.
with our healthcare backgrounds can make this much easier.
And of course, let's end with some take-home messages that you want to leave with the Kevin MD audience.
What I think is it happens when we transform the system around patients to ensure consistency, accessibility, and improvement. So whether you're a nurse practitioner, physician, or even an allied health professional, you should have the ability to lead from where you stand and keep the patient at the center. Challenges, and there are so many things that we are looking at, but don't underestimate the ability to drive meaningful change.
Shabeena, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Kevin, for having me.